Thank you for joining this episode of UAB Medicine's Post-COVID Lunch and Learn series. Today, Dr. Carly Elston, Assistant Professor in the Department of Dermatology, will be discussing hair loss in hives, post-COVID symptoms in dermatology. Please submit your questions in the Q&A, and if time allows at the end of today's presentation, Dr. Elston will try and answer as many questions as possible. For those of you new to Zoom, you will find the Q&A button at the bottom of your Zoom window. I will pass this over to Dr. Elston. Dr. Elston?
Thanks so much, Laura. It's a pleasure to be here speaking with all of you today. So like she mentioned, I'm going to be talking about post-COVID symptoms in dermatology. So we'll talk about how the COVID-19 virus affects not only skin, but your hair. And we'll talk specifically about hair loss and hives, which are two of the most common symptoms that we've seen in patients who have or are recovering from COVID-19. So hopefully some of you have been able to catch the other lectures in the post-COVID webinar series. We're about right in the middle right now, July 7th. There's been an overview of post-COVID disease by Dr. Overton, symptoms in the cardiovascular system from Dr. Perry. We've had neurologic complications and lung complications. If you weren't able to catch them, they are available for streaming online. So we'll talk first about coronavirus and your skin, what you can expect if you have COVID-19, and if you've recovered, what you can expect later after having COVID-19. The good news is the majority of people who have COVID never have symptoms with their skin, never get a rash. The most common symptoms that we see are fever in 88% of patients, dry cough, fatigue, sometimes difficulty breathing or shortness of breath, muscle aches, joint pain, sore throat, and headache, because it is a respiratory virus. But we do know that up to 20% of patients can have skin findings related to their COVID. There are case series that have looked at patients all over the world in China, Italy, Spain, that have seen similar numbers to that. We know that skin findings are some of the most varied or diverse of COVID-19 symptoms. And the skin findings can come before the diagnosis of COVID-19 and can sometimes lead to the diagnosis in some cases, can come up during the fever and cough and acute symptoms of COVID-19, or can follow the illness. So what is the timing of these rashes in relationship to symptoms of COVID-19? I alluded to that a little bit. The first bucket of COVID type rashes are ones that arise in the acute COVID-19 period. So these are rashes that occur at the time of COVID infection or just before and last up to 4 weeks after the illness starts. We see a lot of rashes and skin manifestations in dermatology that are COVID associated, but not directly caused by the virus. So they arise during infection or sometimes shortly after, and they're caused by things related to the COVID infection, COVID symptoms like sweating or fever, sometimes treatments or hospitalization and illness. And then what do we mean by the post-COVID-19 period and post-COVID symptoms? These are symptoms that develop during or after COVID-19 and continue beyond 12 weeks after the illness starts, and they don't have any other diagnosis or cause that could explain them aside from COVID-19. Let's talk about what types of rashes come up during acute COVID, what they look like, and how long they last. The most common rashes that we see with COVID are a widespread viral rash, which is something we call a morbilliform rash, itchy hives or urticaria, some people call them welts, little blisters that we see more often in folks who are in the hospital from their COVID, usually on the chest or the back, and purple spots on the toes or feet that we call COVID toes. Less commonly and more often in patients who are very sick from their COVID and in the hospital, we can see bruising related to blood clots. Those bruises usually look like a net-like pattern or a star-like pattern. We know that the COVID-19 virus can cause blood clots, and that's sometimes how we see it in the skin. And then there are more severe types of viral rashes that we can see, usually in children who are very sick with COVID-19, either during infection or afterwards, with something called MIS-C, which is a multisystem inflammatory syndrome. How long do these rashes last? Usually it's pretty quick that they go away. So the viral rash and blisters usually last about a week. The hives or urticaria can last anywhere from a few days to a month. And the COVID toes can last a little bit longer, between 2 and 8 weeks. Rarely any of these rashes can last a little bit longer. We'll talk first about what hives or urticaria look like, and a type of hives that we see after COVID-19 called dermatographism, which means skin writing. We see a picture here on the right of hives. They're raised, usually swollen spots on the skin that can be pale or skin colored. Oftentimes there's a little redness or a little white change around the hive, but sometimes that can be harder to see, especially in folks who have a little more pigment in their skin. The individual hive lesions come up pretty quickly and tend to come and go and move around. So an individual spot, if you were to circle it on your skin, usually lasts only a few minutes or up to 24 hours. And they are very itchy. We know from studies that itch is actually a lot worse than pain for patients. So people can be quite miserable if they have hives. It can make it hard to concentrate during the day, it can make it hard to get to sleep at night, but fortunately there are things we can do to control the symptoms. And these hives can come up before with COVID-19 symptoms or sometimes after COVID-19 symptoms, but generally patients are pretty healthy and do well with their COVID, which is the silver lining. Skin writing or dermatographism is a type of hive. It's the development of itching in a hive after pressure is applied to the skin with stroking or scratching. So we see a patient here who has scratched with their fingernails, and everywhere their fingernails have touched on their skin, they have a big red itchy welt. Sometimes it's not triggered just by stroking or scratching. It can be triggered by clothing, usually where it fits tightly on the skin, so around waistbands and bras. Sometimes if you have a backpack on your shoulder and that's rubbing, or a bag, that could cause dermatographism. Usually comes up pretty quickly after the skin is touched and lasts up to an hour, but can flare multiple times throughout the day. And some patients do have pretty continuous symptoms from their dermatographism. And we've seen this, again, usually in healthy patients after they recover from their COVID-19. We see it very commonly in patients who don't have COVID as well. We'll talk a little bit next about the viral rash or morbilliform rash and COVID toes. Here on the right, you can see a viral rash from COVID-19, which is usually red, widespread spots or bumps all over the body. Generally, it starts on the chest, the belly, and the back, and spreads out, can involve the arms and the legs. Most of what patients generally notice is the color change. So they look at their skin and say, wow, it's really red all of a sudden. Sometimes that's more noticeable after they get out of the shower or they exercise and they're hot. Sometimes it's itchy, but oftentimes there are no symptoms associated with it. Usually comes up right around the time the cough and fever and other COVID symptoms arise, and generally goes away on its own within a week without any treatment. The so-called COVID toes are reddish or purplish spots that come up on the toes. Usually, again, like the viral rash, patients only notice the color change on their toes and just notice that they look a little bit purple, usually around the nails or on the top of the toes. But people can have associated swelling, blistering, maybe some mild itch or discomfort with the bumps. We see this most often in young people who have COVID-19, so children, teens, and young adults, who tend to be pretty healthy and usually have very mild COVID symptoms that they may or may not have even noticed. The viral rashes and hives usually come up at the same time as the COVID infection, but COVID toes usually develop a few weeks after the COVID infection and then can last a little bit longer, like I mentioned, 2 to 8 weeks. Sometimes when these bumps come up, it's actually a separate rash that's not related to COVID. We see that commonly. It looks very similar. It's called perniosis and is usually related to cold, rainy weather in the springtime and is more often tender. So what can you expect if you have a rash related to your COVID? Fortunately, most patients don't require medical attention and their symptoms resolve in days to weeks. For people who do have more persistent rashes or symptoms like itch, for example, evaluation might be needed and it can be helpful to mention it to your doctor. There are many common rashes and hair loss that we'll talk about in a moment that arise in association with COVID-19 infection, even though they're not directly caused by the virus. And a dermatologist can help you sort all of that out and make sure that you have the right diagnosis and you're getting the right sort of treatment. So we'll talk about some of the rashes and skin conditions that come up after COVID-19. And we'll talk first about the ones that are not caused directly by the COVID virus. So things that cause these rashes are fever or heat. Oftentimes people are not feeling well, so they're kind of bundled up in a lot of blankets in bed, might not be moving around, doing as many things as they were before they got sick, and their skin isn't breathing if they're all bundled up. Can be caused by medicines used to treat COVID infections or symptoms. In particular, steroids can make a lot of skin infections worse and can cause acne bumps. And hospitalization and prolonged illness can cause a lot of problems in the skin in all patients, whether or not they're hospitalized for COVID-19. Some of the things that we see in our clinics are ringworm or superficial fungal infections, acne bumps, which can come up alone or in relationship to steroid treatment or dexamethasone, sometimes a heat rash from being bundled up in bed, folliculitis, and patients who are prone to cold sores or fever blisters, which are caused by the herpes infection or the herpes virus, can sometimes have outbreaks of cold sores around the time that they're sick and their body is going through a lot. People who had chickenpox as a child can get an outbreak of the shingles virus while they're sick and their immune system is busy dealing with other things. The good thing to know about these skin conditions is that they're common in our dermatology clinics, both in patients with and without COVID-19. They make up the majority of people that we actually see in our clinics for post-COVID rashes. They're usually mild, they last a very short period of time and can respond to very simple treatments, usually topical creams and antibiotics or antifungal medicines. Now, because they are common in patients who have COVID and patients who have never had COVID, if you're exposed to the same things that cause this to flare in the first place, for example, heat, humid weather in the summer, sometimes you can have chronic flares of the condition unrelated to your COVID-19. What if you have long-lasting hives, and what can be done for treatment? The great news is that the symptoms can usually be controlled, so that's the itch and the swollen bumps on your skin. Hives can be chronic, which means that they last for more than 6 weeks. For a lot of patients, even if they do last longer than 6 weeks, they'll usually go away all on their own within a year. But some patients who develop what we call autoimmune urticaria or autoimmune hives can have hives that last for many years. It's just something that sticks with you. But fortunately, we can treat the symptoms. We don't know 100% why hives come up in relationship to the COVID-19 virus, but we think it has something to do with the way your immune system is responding to the virus and trying to get rid of the virus. Something can misfire, and then you can develop these hives. Treatments that we use for hives are usually antihistamines or allergy pills. So these are very safe medicines that you can get over the counter, like Allegra or Zyrtec. They tend to work a little bit better than Claritin. Patients often need higher than usual doses of those antihistamines, especially for stubborn hives. And there are other medications, both pills that you can take by mouth and sometimes IV medicines for more tough or stubborn hives. We'll talk about hair loss next. And I know this is an issue that I have seen a lot in clinic in patients who have had COVID-19. We see it in patients who have gone through other stressful illnesses or life events as well. What causes it is something called telogen effluvium. Patients get lots of hair shedding, so you'll notice hair coming out in your hairbrush, on the floor, on your pillowcase. A lot of times, lots of hair, clumps of hair coming out in the shower, which can be very, very stressful for patients when they first notice it. And when it's going on for a period of time, you wonder, am I going to regrow my hair? What's going to happen? And we'll talk about all of that. The most important thing to know is there's nothing you could have done to prevent the hair loss and nothing that you can do about those hairs coming out, but they will regrow. So that's wonderful news. So what is telogen effluvium? In order to understand that, I think it's helpful to understand how the hair cycle usually works normally. So your hair grows for about 3 years, and most of your hairs are in this growing phase, and only a few are in the resting phase at any given time. So about 5 to 10% of your hairs are resting. That's what we call the telogen phase. The telogen phase or resting phase lasts about 3 months before the hairs then shed. Normally, you have that small percentage of hairs in the resting phase, they last for 3 months, then they shed, and you have a very continuous amount of hair that you notice in the shower, in your hairbrush, etc. But when you go through something stressful and you have a telogen effluvium, most of your hairs can enter that resting phase at the same time, and then 3 months later, your hairs all start to shed at the same time. So it's not uncommon for patients to come in and say, I had COVID in April, I was really sick, I was in the hospital, or I was really sick and I was just at home. And now suddenly 3 months later in July, my hair is coming out in clumps, what's going on? That's actually the time frame that we usually see for post-COVID hair loss. So that's nothing to worry about per se. And we can talk about things that you can do and the good news, which is that the hair will regrow. It doesn't just happen after COVID-19 infection. There are a lot of other causes for telogen effluvium. It happens commonly after childbirth, after stressful life events or stressful years, hospitalizations, surgeries, sometimes starting a new medicine can trigger a hair shed, and certainly crash dieting, major weight loss can contribute as well. So important things to know: you will not go completely bald. You will potentially lose a lot of hairs, but every single hair that falls out will be replaced by a new regrowing hair. You have to be patient, unfortunately, because it will take many months for your hair to grow back. It grows very slowly. So I usually tell patients 6 to 9 months to start to see any improvement, and a year or more before you really feel back to normal. And it's important to know that ongoing stress can cause ongoing shedding. So if there's stressful life events, or if you're very stressed about your hair, that can make the hairs continue to shed, and it can be hard to shut that process down. So what can you do about the hair loss? What can be helpful? First of all, don't stop washing your hair. If you stop washing your hair, bacteria and yeast that are common on all of our scalps can grow. You have more of it. It can cause problems on your scalp that can make the shedding worse. It's oftentimes stressful for patients to see a lot of hairs coming out in the shower, which is why they want to stop washing their hair, because it's traumatizing every time it happens. But those hairs have decided they were going to come out anyway. The faster they shed out, the faster a new one will come and regrow. Minimize stress as much as possible. Focus on hobbies that you like: yoga, meditation. Take your mind off your hair as much as possible and just give it time to regrow. Make sure you're eating a well-balanced diet with lots of protein. You need lots of nutrients to be able to regrow hair. If your hair shedding is lasting longer than 6 months, there might be something else going on, and that's a good time to mention it to your doctor and likely see a dermatologist. So I'll talk briefly about COVID vaccines and the skin. We do see occasional vaccine reactions in the skin related to all 3 of the COVID vaccines that are currently approved. So Pfizer, Moderna, and the Johnson & Johnson vaccine. Usually it's an itchy or sore red spot, generally right around the vaccination site on the arm. And we can see a patient who had a vaccine reaction from the COVID vaccine here on the left. Usually starts just a few days after vaccination. It's usually very mild, only lasts a few days, and then goes away on its own. Fortunately, we have no evidence to suggest that the vaccine negatively impacts skin disease. So patients who have pre-existing skin disease will sometimes ask us questions. If I have psoriasis, can I get the vaccine? If I have alopecia areata, can I get the vaccine? If I have lupus in my skin, can I get the vaccine? We have no evidence to suggest that it causes flares of existing skin disease, and we do recommend it. So we'll summarize today's key points to remember. COVID-19 can cause a variety of rashes and hair loss. Most of the rashes and symptoms will resolve on their own within days or 1 to 2 months. COVID-19 related hair loss, which is called telogen effluvium, will resolve on its own, but does take time, usually many months. There are many common rashes that arise around the time of COVID-19 infection. Fortunately, they're usually mild and they respond well to simple treatments. Patients who do have ongoing or worsening symptoms should seek further evaluation and mention it to their doctor. We're certainly happy to see anyone in our post-COVID clinic in dermatology. Vaccine reactions that come up in the skin are generally mild and resolve on their own in a few days. We have the website here at the bottom for you to register for other episodes in this post-COVID series at uabmedicine.org/postcovid. So next week, July 14th, there's going to be a lecture from Dr. Cho talking about sense of smell and loss of the sense of smell after COVID-19. So you can tune in next week for that lecture. And I think, Laura, you can tell me, we may have some time for questions.
Yeah, absolutely. Thank you, Dr. Elston. We have received some questions from participants. The first one is, I've had COVID twice, once in October of 2020 and once in December of 2020, and I'm still losing a lot of hair. How long will this continue?
I think that's an excellent question. So you certainly had a really stressful year if you've had COVID twice. After you have the COVID-19 infection, usually we see the hair shedding start about 3 months after that. So if you had COVID in December, possibly if you were sick into January, then that should start in March to April and can sometimes last a couple of months after that. So usually 1 to 2 months, and then you'll start to notice little short regrowing hairs around your hairline over time, sometimes little hairs that stick up right in the middle of your hairline, and that'll start coming back. If there are ongoing stressors or other illnesses, new medications, sometimes the shedding can last a little bit longer, but should get better after that time. And if it's still going on for you and you're still shedding the same number of hairs, sometimes it can be helpful to collect them. I know it sounds funny, but in the shower and just kind of look at how many are there. Up to 100 to 200 hairs is normal. But if you're having more than that, or if it's still going on, it's helpful to see a dermatologist.
Okay, the next question sort of builds on that and is, what could prolong my hair shedding?
That's also a great question. So ongoing stress is definitely something that can prolong hair shedding. So stressful life events, stress about your hair can prolong hair shedding. Any dandruff or flaking or itching that you have on your scalp can sometimes prolong hair shedding. And certainly anything, if you're not eating a well-balanced diet, trying to lose weight, dieting, new medications, those things can sometimes prolong hair shedding.
Okay, and then next, is there a relationship between the COVID vaccine and alopecia areata?
That's a great question. So we have a lot of patients, alopecia areata patients and patients with other skin disease who have asked us that specific question, can I get the vaccine if I have a skin disease? So the first thing to know is we don't have any data to suggest that there is an association between the COVID vaccine and developing an autoimmune condition like alopecia areata or worsening of a skin condition like alopecia areata, which is great news. There certainly are a lot of patients with alopecia areata who will have a flare of their hair loss after something stressful or an illness, if their allergies are flaring, for example. So it is possible that somebody could have a flare. We just don't have a lot of information yet. There are some patients with autoimmune conditions, including alopecia areata, who are on immune suppressing medicines who have a lot of questions about the vaccine. Fortunately, all of the vaccines that are approved do not have live virus in them, so they're safe to get if you are on an immune suppressing medicine for your skin disease. We don't have a lot of data, though, because there weren't patients on those types of medicines in the trials to know if it affects people's response to the vaccine. But the American Academy of Dermatology and the Alopecia Foundation all recommend getting the vaccine.
Okay, and there's one more question. Have you heard of any cases of COVID only presenting with hives and subsequent hair loss?
So there certainly are patients who have had conditions in their skin or a rash in their skin, something like hives, commonly with the COVID toe reaction, where we're very, very suspicious that they did have a COVID infection. And certainly if they weren't tested at the right time or before we had really good tests for COVID-19, it's possible that it might have gone on undetected. So that is possible, but these conditions are also extremely common. And it's been a stressful year for people. So sometimes you just get urticaria. We see it a lot in our patients who don't have COVID-19. And we certainly see lots of hair shedding in patients who don't have COVID-19.
Okay, so if there are no further questions, we will end today's Lunch and Learn. Thank you for joining us. We hope this information has been helpful and informative. To register for other post-COVID Lunch and Learns, please visit uabmedicine.org/post-COVID. Thank you, Dr. Elston.
Thank you.